Good day. We will be presenting our paper entitled In Silico Study of 2B2 Inflammatory Properties and its Interaction with IL-17A. My name is Rachel Sardoma and I will be discussing the background of our study. Sulfur heterocycles are compounds that has a wide range of pharmacological activity that can treat various diseases. Benzothiophene, being a sulfur heterocyclic compound, has been known to have inflammatory, anti-allergenic, and antiviral properties to name a few. Thus, its derivatives are garnering interest in drug development or in the medical field in treatment of diseases. One particular benzothiophene derivative is the 1-benzothiophene 2-carboxylic acid or 2B2. From a previous study, it has demonstrated its inflammatory and antiviral properties, making it a potential drug candidate for inhibiting inflammation and affecting the immune response. However, 2B2 has yet to gain popularity, and there has not been that many studies on 2B2. To observe the inflammatory effects of 2B2, we associate it with interleukin-17A, which is a member of the interleukin-17 family. It was chosen since it's the most well-studied IL-17 member along with IL-17F. Moreover, IL-17A plays a crucial role in host defense against pathogens. However, dysregulation of this molecule could lead to tissue damage and autoimmune diseases, such as multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, and psoriasis. Thus, this study aims to determine the anti-inflammatory properties of 2B2 when bound to IL-17A and to compare their interaction with a HIT compound and with a benzothiophene drug derivative, raloxifene.
Greetings, I'm Brian Harvey A. Villanueva. So I'll be discussing the methodology, results and discussion, and conclusion of our study. So I have here a flow diagram or schematic for our methodology. The first step is retrieval of the corresponding ID, code, or data file for the protein and ligand required for the following online web tool. So the first step is network analysis using gene disease association. It tells us the gene disease associated with interleukin 17 aside from inflammation, allergy, and autoimmunity. Then protein drug interaction tells us the drugs that have been used or reported against interleukin 17. Potion packet similarity, where search P is useful for predicting ligands that potentially bind to our structure of interest. Search K is useful for finding a similar binding site for a known ligand binding site. Then drug search is useful for retrieving ligand, followed by PAC drug prediction. Using the protein, it can determine the druggability of a certain protein using the druggability prediction using a protein, followed by molecular docking studies. So doctor is used for the affinity and total energy determination of our docking, followed by Swiss dock using view dock sector. It tells us the Gibbs free energy of the binding for different elements and cluster of the ligand and protein complex. And DINC version 2 is used for corresponding supporting molecular docking information, followed by pharmacokinetic studies. So mole inspiration is used for the bioactivity, which tells the drug likeness of the compound. Then PKCSM is used for the ADMET study, which stands for absorption, distribution, metabolism, excretion, and toxicity. So for the results and discussion, network analyst was able to show us that gene disease association of interleukin 17 family, and it is reported that interleukin 17D is much involved in different gene diseases, followed by interleukin 17A, and the list is interleukin 17C. So interleukin 17A is used for protein drug interaction, at it is reported to be a pro-inflammatory cytokine. So there are only two reported drugs against interleukin 17A, which are both humanized antibody drug. So the few reports of drug against interleukin 17 requires a great focus in drug designing or drug determination against interleukin 17 as anti-inflammatory drug. So using POSHUM, it was able to tell us that interleukin 17 has 25 hits using search P. So interleukin 17A has a protein ID or PDB ID for HR9. So these are the 25 hits obtained from search P. So the top hit is 5HI5, interleukin 17A. So using the top hit from 4HR9 using search P, we are able to determine that 5HI is the top hit. So it was used for search K and reported that it has 2 known hits and 27 putative hits. So using drug search, we are able to determine that there is only one benzothiophene-derived drug, which is the RAL or raloxifene. So PAC drug prediction were able to help us determine the drugability of two protein. So we compared the results of 4HR9 and 5HI5. So 4HR9 has higher drug probability compared to 5HI5. Also, 5HI5 has higher pockets compared to 5HR9, and here it shows the pocket site of the 4HR9 in pocket 0. Also here the pocket site of 5HI5 in pocket 0. So you see here is the dimer. So for the molecular docking studies, first step is doctor, using doctor. So the protein that we use is 4HR9 and the ligand that we use is 2BT. As RAL is already a reported drug, then 2BT is not yet a reported drug. So screening to it is important. Then 4HR9 has higher drugability compared to 5HI5. That is why the 2 is used to form a protein ligand complex. So Doctor gives us the affinity, total energy, van der Waals energy, and electric energy, which is highest in the 23rd run with a negative 16.60 total energy and 8.19 van der Waals energy and negative 41.38 for electric energy. So Swiss Dock molecular docking study were able to tell us the binding energy at different cluster and element, and it is said that delta G is morely negative or highly negative at cluster 25 by element 11, and most negative full fitness is 781.74 kilocal per mole from packet 0 or cluster 0, which supports the information obtained from POC drug. And this negative binding or delta G shows us that the binding of the ligand and protein is spontaneous, giving us the docking study is successful for 2BT and for HR9 complex. So mole inspiration is used for the pharmacokinetic study of 2BT. So it tells the bioactivity score of our 2BT ligand, and using the reference information obtained from mole inspiration, it shows that these bioactivity scores of the 2BT shows a drug likeness activity, and it is now a candidate to be a drug against inflammation. So mole inspiration also shows us the properties of the 2BT ligand. So it is shown here. So this is the data obtained from mole inspiration, an online web tool as well. Finally, for pharmacokinetic study of PKCSM gives us the ADMET result or absorption, distribution, metabolism, excretion, and toxicity of the 2BT. So for the absorption, 2BT is found to not inhibit or be a substrate to P glycoproteins. Next, we have skin permeability. This value suggests that 2BT has a high transdermal drug delivery. Next, we have intestinal absorption, which is very high, 98.82. suggests that 2-BT could be administered orally. Next, we have the CaCO2 permeability, shows the absorption of the 2-BT when orally administered. Then we have the water solubility, which is negative 2.1. So for the distribution, 2-BT is readily cross the blood-brain barrier with this result of B permeability, and it also penetrates the central nervous system with this value of CNS permeability. Next, we have the fraction unbound, tells the blood distribution in the plasma of a human. Next, we have the volume distribution, stands for VD, in humans, which is negative 1.98. For metabolism, so 2-BT is found to be or does not interfere with any cytochrome P40 family, so it is not an inhibitor or substrate for any cytochrome that involved in metabolism. Next, we have the excretion. So for the renal excretion, our renal octosubstrate, 2-BT is not involved. For the total clearance, it is 0.18, which is the addition clearance of renal clearance and hepatic clearance. For toxicity, 2-BT is observed to have a hepatotoxicity because of the first fast effect of the liver when orally administered. Then it has no skin sensitization, suggesting that it has no allergic reaction or side effect, but it is toxic to T. pyriformis and flathead minnows. So for acute toxicity in rat, 2.30 mole per kilogram is enough. And for chronic toxicity, 1.8 mole per kilogram could form a chronic toxicity to rat. So it is not an inhibitor of HERG1 and 2 inhibitor. Then the maximum tolerated dose for human is 0.62 milligrams, and there is no AMES toxicity. So for the conclusion or summary of our study, interleukin-17 cytokine is not only involved in inflammation, but also in various gene-associated diseases. So there is a lack of drug against interleukin-17 cytokine, which is a great target for drug designing. 4HR9 and 5HI5 are lead protein receptor as suggested by the POSUM. And then two ligands are proposed, which is the ROL and 2-BT, which are both benzene-derived compounds. 4HR9 has a higher druggability compared to 5HI5. That is why it is used for molecular docking studies. And 2-BT was chosen ligand because it hasn't reported as a drug, while RILE is already a drug reported to inhibit estrogen hormone. So for the molecular docking studies, 4HR9-2BT complex has a great binding affinity with the negative delta G, suggesting that the binding is spontaneous. So 2-BT has a great bioactivity, showing that it has a drug likeness property, and ADMET result or pharmacokinetic study in ADMET suggests that 2-BT could be orally administered but has a toxic effect on liver. Finally, 2-BT has an anti-inflammatory activity as it inhibits interleukin-17 cytokine, which is a pro-inflammatory cytokine present during inflammation. Further study of 2-BT is required to be for it to be considered as anti-inflammatory drug. Perhaps further in silico studies needed, and in vivo and in vitro models could be possibly done, and clinical trials as well is required for 2-BT to be considered as a anti-inflammatory drug. Thank you.